everyone. So my name is Briana Boteo, and as Professor Wren stated, I'm a double majoring in Spanish and Community Wellness Studies with a focus on reproductive health and mental health. I joined the WSP fam around, I believe, my sophomore year. And I joined because I realized how specific my passion was. Um, and my dream is to create organizations and programs focused on catering to communities of all different demographics. At this moment, I would also like to just give a trigger warning. In this presentation, there will be mention of suicide and mental health topics. Okay, so, well, it all started my sophomore year. At that moment, I was going through a mental health crisis, and I ended up being on suicide watch on campus. Due to being on suicide watch, I was connected to many different resources on campus, and one of them was the Disability Service Office. Because of my mental health crisis that I was experiencing at the moment, I actually began to fall behind in classes. So naturally, I gravitated towards the Disability Service Office in hopes that they could help me. I was able to get a grace period that sophomore year. But unfortunately, when I came back my junior year, I was still struggling with my mental health. But due to not having a letter from a long-term therapist, which was a required documentation by the office, I was unable to continue to receive services. At that moment, I was taking sociology, social work, and psychology classes, which were helping me really start to learn more about myself, as well as understand myself and my background and the role that played in my life. So then I began to ask myself, why is it so hard for me to get the help that I need? With this question in mind, I found that my cultural upbringing had actually put me at a disadvantage. You see, in Latino culture, mental health is a very taboo topic. And for this reason, I was unable to get therapy my whole life. So because of this, it had also created a mental barrier where it was hard for me to even reach out for help in the first place. So when I reached out and got denied, it actually really discouraged me. And in turn, I actually started getting kind of mad. So then I asked myself, how can I get access to these resources? And who do I need to talk to get access? I reached out to the Disability Service Office and I met with the people in charge. And despite having multiple meetings with them and asking for help, I was still unable to get the necessary documentation and the help that I needed. I then went to my mentor at the time and I asked her to help me. She did try to reach out and to help, but due to the policy that is currently active in the office, there wasn't much she could do for me. So my situation ended up staying the same and I was still unable to get the services that I needed. Again, I found myself discouraged and I began to ask myself different questions. Why haven't I focused on my mental health as much as I should have? Why do all these students have therapy and this paperwork is like nothing to them? But then I said, I can't be the only one struggling right now. This thought process then led to my research question, which is what social structures affect the level of attention an individual gives to their mental health? After researching this topic a little bit further, I found my main social structures to be race and ethnicity, socioeconomic status, and immigration. With all this in mind, I designed my project to have 3 components: a literature review, which explored already existing research, a quantitative data section, which also explored already existing data and graphs, and lastly, a disability service policy proposal, focused on creating a more inclusive and welcoming policy where students get the full support they may need, regardless of paperwork available at the time. After doing my research, I found that barriers vary among different race and ethnicities. I found that amongst Blacks, systematic racism and economic hardship is one of the main struggles that they face. For Latinos, I found that they also faced systematic racism, economic hardship, but they also faced a lot of stigma and self-stigma created by cultural barriers. Asians also, I also found that Asians dealt with stigma and self-stigma also created by cultural barriers. And lastly, I found that whites mostly buried among their socioeconomic status. I also found barriers among low and high socioeconomic status. And I found the low socioeconomic status is actually mostly correlated with mental illness. For immigration, I found that immigrants tend to struggle due to a language barrier, which prevents them from accessing care, as well as creates this mistrust in the system. But I was really interesting that I found that for immigrants, their cross-border ties or their social ties actually correlates to a positive mental health. So this is just a quick graph I wanted to share. In this figure, we see that mental illness is most prevalent among adults ages 18 to 25, which tend to be college students. In this next figure, we see how US-born citizens tend to have a higher level of emotional difficulty than immigrants who have been in the United States 5 years or less. I found that this was mostly due to the cross-border ties and social ties that I mentioned earlier. These social ties tend to give immigrants something to really like look forward to and continue to be motivated towards, which creates a positive mental health experience. Okay. And lastly, this is my policy proposal. So my policy proposal aimed to create an inclusive and welcoming environment for all students at Whittier College. This is in hopes to give students a greater chance at succeeding and accessing mental health services on campus. I also hope to open doors for all students to succeed, regardless of their demographics or the paperwork that they have at the moment. The main outcomes of my policy proposal are to create a welcoming and inclusive environment where students feel comfortable to seek the necessary resources and help that they may need. Second, to provide students with guidance and support to acquire the necessary documentation for long-term services. And lastly, to stay true to case-by-case claim in the original policy. And to take into consideration the backgrounds and need of each student. Okay. In conclusion, understanding the barriers others may face to keep people from succeeding is crucial to success of a diverse institution, as well as the success of any organization or program striving to help the community. At this moment, it would be my honor to give a special thanks to all the amazing people that helped me. First, to my sponsor, Julie Collins-Dogrul. Thank you so much for all the help that you have given me and the guidance. I also want to give a big thank you to my mentors, Siobhan Scurry and Deanna Marino Contino. These three women have been helping me all 4 years and have really just guided me and motivated me to become empowered and hopefully to be really successful. So thank you so much.